Hi, welcome to Healthy Living. My name is Amy Bouton. I'm from St. Tammany Health System, and today we are getting ready to go into October, which is Breast Cancer Awareness Month. So today our special guests, we have three. We're going to talk about all of the things St. Tammany Health System has to offer as far as prevention, screening, and education and cancer awareness. And our first guest today is our President and CEO of St. Tammany Health System, Joan Kaufman. So we're thrilled to have you with us today.
Well, I'm thrilled to be here.
So let's first tell people a little tidbit about yourself, because you have some interesting facts that connect you to St. Tammany Health System.
Well, I don't know about interesting, but certainly blessed. When you think about my tenure here at St. Tammany Health System, I think one of the things most people don't know is this is my second time being employed by St. Tammany. My first time was right after I graduated from X-ray school at Ochsner Health on the South Shore. My very first job as an X-ray tech was right here at St. Tammany Health System.
Wow. So you have seen the transformation.
Huge transformation. And what's interesting about the transformation, you know, St. Tammany Health System was created back in 1954. So we're actually going to celebrate 70 years next year.
Very exciting.
When I was with St. Tammany Health System, so think about that. They started with 30 beds. Today we are now licensed for 281 beds.
That's amazing.
When I was at St. Tammany Health System, it was in the early 80s, and while the culture is still exactly the same, we just now have 2,800 colleagues.
Right.
We were much smaller. It was a two-story facility and certainly much smaller.
It does feel small. The culture is a small family culture.
Yes, and I'm grateful that the culture has not waned.
That's right. Well, good. Well, that's an interesting fact. I'm glad you shared that, because I do believe a lot of people don't know that about you. So speaking of all of the growth and the exciting things that are happening, we've had a really big summer. We're out of summer now. Still feels a little warm outside, but we are out of summer. But we had a really big summer, specifically as it relates to the St. Tammany Cancer Center. So fill people in, if they don't know already, about what's going on there.
Well, St. Tammany Health System has been in a long-standing partnership with Ochsner Health since 2014. We have been providing cancer care in the community since 1998. So we really have done a great job, I believe, of trying to meet the needs of the community and really expand services and continue to grow our ability to serve in a meaningful way. One of the things we did a couple of years ago was to identify a location that we could create St. Tammany Cancer Center. And that, to me, is now the gateway to healthcare along the highway I-12, 21, and certainly Ochsner Boulevard. And the building that stands there today is completely state-of-the-art and creates sort of a one-stop shop for treatment of cancer.
Very important.
But the most exciting thing that has happened of late was on June the 22nd, when Ochsner and MD Anderson came together in one of only 7 partnerships across the country to create a more expanded experience for our patients in our community. And by virtue of our partnership with Ochsner Health, we now, St. Tammany Cancer Center, is a part of a 3-way contract that allows us to continue to benefit our patients in our community through the partnership of Ochsner and MD Anderson.
And that is huge for this community. So we know the importance and the weight that carries. For the patient, what does that mean for patients in the area, newly diagnosed, in a current cancer diagnosis, halfway through their journey, partway through their journey? What does that mean for the patients here on the North Shore and in the region, basically?
Great question, and I think it's important for our patients to truly understand that. We are very fortunate through the partnership with Ochsner and MD Anderson that we now have access to select clinical trials for our patients. We're able to expand services and create a virtual connection to providers at MD Anderson, so we have the same skill, expertise, and pathways that they do in Houston. I think, you know, for patients to know, to be very honest, that if they are being treated at MD Anderson today, their physician there will not be at St. Tammany Cancer Center, but access to that physician is going to be the benefit of this relationship.
And there were a lot of things that we did to sort of meet MD Anderson where they needed us to meet them, to improve our standards even more.
So it's interesting, Amy, you know, 3 years ago, so even before St. Tammany Cancer Center was constructed, we began the journey with our partner Ochsner to look at what the gaps in care were based on the MD Anderson standards and begin to close those gaps. Clinically, we had 107 gaps that we had to close.
Okay.
Our team knocked it out of the park. And this is the team not only at the St. Tammany Cancer Center, but also at St. Tammany Parish Hospital, which is our flagship. And then also the Women's Pavilion, really coming together to understand what the goals were of MD Anderson so we could be on a level playing field for our patients.
So add to that the multidisciplinary approach that was already in place at the St. Tammany Cancer Center. So let's talk about what that is, because when we say that, a lot of people don't know what that means. And you mentioned a one-stop shop, but then add to that the multidisciplinary approach and MD Anderson, and you just can't beat what we offer.
You really can't. That to me is the secret sauce. When you think about care, as we looked around 2 years ago and thought about how care was being delivered for patients with cancer, it was very fragmented. And we really felt terrible for our patients because when you get a diagnosis of cancer, you want answers right away.
Right.
And so one of the things that has been so beneficial in this partnership is really creating that multidisciplinary approach. So you have physicians, clinicians, support staff, and that's social workers, navigators, nurse navigators, psychologists, really coming together in one location so that the patient doesn't have to go from one physician to the next physician, potentially in 2 different cities, to seek the answers that they're looking for.
Right.
So we have a dynamic team that comes together and talks about each of our patients so that they have the answers that they need and the direction for their path forward right away.
And I know that it's important to patients that, one doctor, not some patients, I think, okay, one doctor's making my decision. That can be scary for them. You have a team, and that team is looking into every possible thing that they can based on that diagnosis and making the best path forward for
That's exactly
treatment.
what they do. And everybody has a voice, and it's important that everybody weighs in. That's why you have that multidisciplinary team, because while you think you are right on top of what you need to do and how you need to direct care, somebody may mention an opportunity that they hadn't thought of.
Right.
It really is a collaborative approach.
So let's just talk one more thing I want to mention about the partnership is some of the things that people might now have access to that they didn't in the past. So what are a couple of those things? Can you kind of expand on a couple of those things, maybe like clinical trials or things like that?
So, MD Anderson is the leader of cancer care in the world. So we're very fortunate to have this partnership with them. And through that, they're always creating new clinical trials and expanding clinical trials. So our patients will have access to those from a select perspective to make sure that they are getting the best path forward that they possibly can. The other thing that I think is important, if you are receiving a diagnosis of brain cancer and need to go under the Gamma Knife, for example, we didn't have that accessible to us in the area before. But our partner, Ochsner, now at the Benson Cancer Center, does have that technology now available. So our whole goal with the partnership with not only Ochsner, but also MD Anderson, is to provide as much world-class care close to home as we can, so patients and families and caregivers don't have to travel.
That's excellent. Is there anything else you want to say before we wrap up? This has been great.
Well, I think it's important that we remember that early detection and prevention is most important. So we are doing so much in that space right now, and you'll see our Be Well bus, which is a 40-foot mobile van, very colorful, you can't miss it, rolling the streets throughout the parish all the time. And it's really meeting patients where they are so that they can take that proactive approach. And we're able to, if we do diagnose a patient with a positive outcome, to get them the care that they need right away. So we hope no one has to walk through the doors of St. Tammany Cancer Center. But I guess what I'd leave our viewers with today is that should you have a diagnosis of cancer, please know that when you walk through those doors, you're going to be embraced and lifted by an amazing care team who not only is professional and celebrating best practices, but certainly compassionate and there for you to guide that path.
Wonderful. Well, thank you so much, Joan. Thanks for being here today.
Thank you for having me. I appreciate it.
Okay. And y'all stay tuned because we are coming up with Tiffany Rayford. She is our Director of Imaging Services. We will be right back.
Here at St. Tammany Health System, we're empowering our mothers, our sisters, and our daughters like never before. Throughout our entire system, we've invested in the highest level of technology available to provide more accurate diagnostics, less invasive care, and faster recoveries. Together with our partner Ochsner Health, we're giving women many ways to live stronger and better.
Welcome back to Healthy Living. We're back with our guest, Tiffany Rayford. She is our Director of Imaging Services at St. Tammany Health System. So Tiffany, thank you for being here with us.
Thanks for having me. Good morning.
Good morning. Tell people a little bit about you and your role at St. Tammany Health System.
Yeah, so I started off at St. Tammany in 1997 as an X-ray student. I was only 5 years old. I was a very smart kid. So much like Joan, I've watched it, grow dramatically throughout the years. I did X-ray, CAT scan, and MRI, then went into management, and now director.
Oh, well, that's exciting, and it's a lot. We have a lot of imaging capabilities now,
Yes.
which is wonderful for our community.
When I started off, we had an old single-phase X-ray machine, and it was, something from the Stone Age, and I've watched the equipment evolve dramatically.
The
It's
technology
great.
is amazing.
Yes.
We're going to talk a little bit about that. So October, as we mentioned in the beginning, is Breast Cancer Awareness Month. And we do a lot of things to educate, screen, prevent. We like that mantra, educate, screen, prevent, because it's very important. Education about early detection and screening leads to prevention. So how does imaging fit into that educate, screen, prevent mantra?
Well, very, very important component. So our board and administration focuses heavily on early detection, as well as the need for advanced technology. So they don't shy away from getting us whatever we need with the latest and greatest, advanced techniques. So we have a comprehensive breast cancer screening program as well as a lung cancer screening program. So, we have the Be Well bus, which provides mammography out in the community, and we have our Mandeville location with mammography and bone density, and then our women's pavilion.
And let's talk about the Be Well bus, mammography out in the community. It may sound to some like, oh, well, is that the same quality of imaging that I would necessarily get if I went in and had my mammogram within a building?
Right.
Speak to that, please, because we just talked about this recently.
Yes. So we are standardized. We have all the same equipment at our Mandeville, Women's Pavilion, and the Be Well bus. So it's all
Okay.
the same equipment, state-of-the-art 3D mammography.
And you and I both mentioned the Women's Pavilion. The Women's Pavilion is off of 190 in the Covington area. And then directly adjacent to the Women's Pavilion is the High Risk Breast Clinic.
Yes.
So let's take each one of those. The Women's Pavilion. When you walk into the Women's Pavilion, what are the services you can expect? And kind of how would I even go to the Women's Pavilion as a woman?
So the Women's Pavilion is a breast imaging center of excellence, and what that means is we're recognized by the American College of Radiology. So we have to follow pretty strict guidelines and requirements to meet that. It's a very prestigious award. It's pretty hefty. We have mammography, ultrasound, as well as MRI there. We just added MRI July of last year. So all three modalities offer biopsy capability, and we have certified breast fellowship trained radiologists.
Okay.
That read. That's all they do is read the breast.
So as a patient, do I have a choice basically? If my doctor says, okay, you need a mammogram, or it's it's time for your yearly mammogram, or you need a diagnostic mammogram because of whatever suspicion the doctor may have, what do I as a patient say to that provider?
You can choose where you want to go.
Okay.
So you can choose where you want to go for your screening, and you can choose where you want to go for your diagnostics. So if you have your screening somewhere else and you get abnormal results, you can certainly go to the Women's Pavilion for anything after that.
Okay.
The Women's Pavilion works very closely with the High Risk Clinic, and so if there's any abnormal findings on a screening mammography, our breast care nurse contacts every patient with an abnormal finding, and they will get them in for additional testing, diagnostic mammogram, ultrasound, even an MRI if needed, perhaps do a biopsy, and then recommend to their breast surgeon with the
Okay.
High Risk Clinic.
So the High Risk Clinic, let's go ahead and talk about that since we're kind of on the topic. Why would someone, we kind of talked about why they would seek out care. What are the services, kind of in a nutshell, that are offered?
So if perhaps you do have an abnormal finding on your screening mammography and you go through the, the channels of finding something that's worrisome,
Right.
they would refer you to Dr. Bonagera, breast surgeon, and the nurse practitioners. But aside from abnormal findings, if you have dense breast tissue or strong family history of anything else that would put you at risk for breast cancer, they also see those high-risk patients.
Okay, so that is
care for
something,
them then.
and they can kind of evaluate your situation and keep an eye on it through the years.
Yeah.
It's a relationship. That's nice. So we did talk about after some screenings, there may or may not be a finding. So we just, this year, we acquired what's called the stereotactic breast biopsy table. And this was very, very significant for the Women's Pavilion.
is.
Can you tell people why? Why is this significant?
So this piece of equipment, we had an older stereotactic breast. And what a stereotactic breast biopsy table means is, so you're laying kind of on your stomach, and the breasts are kind of through some holes down in the table.
Right.
And the new table we got increased efficiency, accuracy, and timeliness. So the patient's not laying there as long. It's a lot more comfortable. You don't see a needle kind of coming at you.
Right.
You're just kind of like on a massage table.
Right.
And all the work is done from underneath. And it's phenomenal. The accuracy and the timeliness, it shortened the time by half, and the patients we've gotten a lot of good feedback.
So I know that before, with the table used previously, the tissue sample is taken, and you have to make sure that you got the right tissue sample, and it would go into another place,
Right,
and
right,
get looked at.
right.
I'm not clinical,
Right.
so. But with this table, it's real time.
Yes.
Everything happens in real time.
Yes, so with the other table, they would take a sample of the breast tissue, actually put it in sort of like a petri dish, and x-ray it on a different machine, just to make sure they got what they needed.
Right.
This one actually kind of goes through a little vacuum and simultaneously takes pictures in the tube. So there's no need for that time waiting to go take the x-ray of the tissue sample or anything like
So
that.
the patient is sitting in that position way less time. The provider is working on each patient way less time. So not only is it less stress for the patient, it's more, like you said, more efficient for you, and you can see more patients that
Yes.
way. The wait time is less, which is
Definitely.
great. So we talked about how we get into the high-risk breast clinic, how we get into the Women's Pavilion, the things we need to do. Is there, what are some other things you want to add about diagnostic imaging services that we provide,
So I think
or imaging services in general?
Yeah, so I think going back to the way our board and administration supports our imaging, we just installed a new MRI at the outpatient pavilion. The time to do those MRIs is going to be cut in half. They really don't shy away from anything we need to make the best care for the patient, comfort for the patient, satisfaction for the patient, without taking away from quality and quantity. So, we're really working on access, to shorten that access to where patients don't have to wait long for an appointment. We've been successful in that this year. We've kind of gotten our days down fairly quickly. If you get a screening mammography that's abnormal, we can usually get you in within 2 to 3 days, or
Very
even maybe
important
a day.
to peace of mind.
Yes. So, they're very supportive on our needs in the care for the patient.
Now, October is Breast Cancer Awareness Month. We encourage all women to get their yearly mammogram if they meet the criteria to do that, or if they're at high risk.
Yes.
So they can do that either in the Be Well bus, they can do it at the high risk clinic. Is there any other place under your purview that they can do that?
No, with the Be Well bus, the Mandeville Diagnostic Center on St. Anne, and then the Women's Pavilion.
Okay.
We are running our $99 special
Oh,
through
great.
October.
Wonderful.
So, and we have truly so many success stories from early detection. It really is extremely important to get your screenings done, find that abnormality soon enough so it can be treated, and you don't have to worry about it. So.
Okay. Well, is there anything else you'd like to add before we wrap up?
We are having, along with our United in Pink campaign, we'll be all over the place, everywhere.
Right.
We have several events throughout the year, screening events, so check out our website. We have a multitude of screenings, carotid screenings, bone density screenings that we do throughout the year. But we are having our Ladies' Night at the Covington Beer Garden next Friday, October 6th at 5.
Okay,
Just
wonderful.
wanted to throw that in
Yeah,
there.
and that's a free event. It's open to the public? Lots of things for women there.
Yes, and we will have some of our screenings. We'll have our Be Well bus there, and we'll have some bone density screenings and some other things there.
Okay, wonderful. Well, thank you so much, Tiffany, for
Thank you
being
for
with
having
us.
me.
I appreciate it. Everything Tiffany and I talked about as far as the St. Tammany United in Pink events and screening locations, you can find at sttaminyunited.org. So stay tuned. We'll be right back with our major gift specialist, Kathleen Thomas.
Innovative healthcare isn't just about robots. It's about people. And world-class healthcare requires a world-class team. We're constantly implementing innovative programs designed to develop and mentor the best and the brightest. We take care of our team so they can take care of you. The St. Tammany Health System team is going places, and our patients, well, they're going home.
Welcome back to Healthy Living. We're here with our guest, Kathleen Thomas. Kathleen is our major gift specialist for the St. Tammany Hospital Foundation. Thank you so much for being with us.
Thank you for having me.
So let's tell the audience a little bit about yourself and then what you do with the St. Tammany Hospital Foundation and St. Tammany Health System.
I am a fundraiser for the St. Tammany Hospital Foundation, and I get the honor and privilege of connecting donors and our community partners to our cancer center and also to our hospital to go ahead and make an impact on our community.
Very important, because the foundation is the foundation of the giving and the connection and making that impact. Especially, I don't know that people know everything that the foundation does. We're not going to be able to cover that today, but it's a significant amount of work in the community. And with October coming up, Breast Cancer Awareness Month, we're going to make a big impact on the St. Tammany Cancer Center and patients' breast cancer awareness education, screening, and prevention. So let's talk about this. St. Tammany United in Pink is the month. And what's the goal in your mind?
The goal is to raise awareness about breast cancer screenings, and it is to educate our community about where they can get them, how they can get them, when they need to get them, and it's also to fundraise so we can keep giving all of the mammograms on the bus to our community everywhere that they are.
So it has let's talk a little bit about the fundraising component, because it's really fun, the things that we do, and it's a good way for people to get involved in all kinds of different ways. So we have the Pink Tahoe, the infamous Pink Tahoe. Tell people about that and how they can participate in that fundraising part.
So we've partnered with the Sheriff's Office, and they wrap a Tahoe and drive it around all of our parish, and you can sign it, you can donate to sign, and all the money goes back to the campaign, and they bring them to community events to raise awareness, because it's always the most popular piece everywhere we go.
Yeah.
And then they bring it also to some of our Pink partners, and our Pink partners sign up throughout the month to do many fundraisers throughout their businesses. Like we have Southern Hotel has a pink drink, and they're donating funds back to our campaign, and we have Chick-fil-A is doing cookies, money back for those, and we have Sunshine Coffee who's doing some pink lids and some pink drinks, and we have Delta College this year who's doing a Dress in Pink Day that all their students can donate. They're also doing pink sweatshirts, and they're having the Tahoe out so that everybody can sign it as well.
It's so much fun.
It is fun. We are painting St. Tammany pink, if you could say, and trying to get everybody involved where they are and how they can be with us.
So if someone wanted to be a Pink partner,
Super easy.
What would they do? How would they get that?
You can visit sttaminyunited.org, and there's a button on there that says Become a Pink Partner. There's also my name, phone number, email address, I think everything that I have on me. And you just sign up. You can call and email, and we can get you on. We can get you listed on the website. Right. We can get you out through our social media channels and all that, so that way we can partner together and raise the awareness and fundraising through you too.
Awesome. So you mentioned, we talked about the Tahoe. Tiffany mentioned United in Pink Ladies Night Out, which is coming up October 6th at the Covington Beer Garden. So that is going to be an exceptional event. We're going to have so many opportunities. Can you expound on that a little bit?
I can. So it's free for the public. Come out. It's at the Covington Beer Garden. It is on October 6th from 5 to 8. We have not only screenings and health screenings, but they have a glitter bar. They've got special drinks. They have a bingo game, and we'll have live music out there. And again, it's free. So come out, bring your girlfriends, make it a girls' night. Right. Come and clink the glasses and learn all about about it, wear your pink, and so it's going to be a really fun event.
So you'll have an opportunity there even to get a mammogram screening if you'd like to, because the Be Well bus will be there.
You can get a mammogram on our Be Well bus. You can also get skin checks by our sponsor, McDaniel Dermatology is coming out, and they're doing skin checks for our ladies, and there's a ton of other checks that they can do. So make it fun.
Okay, so we have so many opportunities to celebrate, you know, if you're a survivor, if you have a loved one that was with breast cancer, during the month of October. But I think that the best way to do that is to get educated, get screened, learn about prevention. So sttamanyunited.org, on that website, we have all of the listings where the Be Well bus will be. I don't know if we have the Tahoe locations where they might be. What are some other ways that people can, if they want to do the philanthropic side of this United in Pink? Because you and I talk a lot about all of the things that the foundation does to partner with different agencies in the community to work with the St. Tammany Cancer Center to make sure that our cancer patients have everything they need. So one of those partnerships is with the North Shore Food Bank to stock our food pantry. So what is a way someone could get involved in that way?
So right now, currently, we're doing a canned food drive throughout our St. Tammany hospital system because our food pantry shelves are a little empty right now. And so we have a wish list on Walmart Spark. We also have one on Amazon. You can send it directly to the Cancer Center to help us fill our shelves to get them to our patients that are in need and currently in need of food. We all know right now with rising prices in the grocery store and also with a cancer journey that it's a little tough. And so we're trying to make it easier and make sure that they have all the food that they need, all the food that is customized to them to get them through treatment as well. So you can visit St. Tammany Foundation's website. You can, again, go on either one of our Walmart or Amazon wish lists, or just email me and you can drop them off to me.
Oh, that would be great. And you get to meet Kathleen in person,
Yes,
which is
come on.
super fun. So when we talk about the impact that it has on patients, you see patients every single day.
I do, in my
You're not
office.
a clinician, but you were located in a place where you see cancer patients every day. So just from your experience in interacting with the patients, what does this mean to them?
It means the world to them. So the patients, I am very lucky to get to see them and get to see the impact every day. And most of the patients that are getting any kind of support from our cancer center, they come and say thank you. They come and say how much it's impacted them with helping them, because not only does our food pantry feed our cancer patients, it also feeds their families as well. So it's a one-stop. They can get all of their clinical things done and also get their food on the same day. And so they're not having to worry about anything else. And I've seen tears, smiles, big thank yous, and so it truly is impacting them in every way and every form to get through their cancer journey.
And anything you can do, we can do to take that a little stress off is wonderful. It's helpful. It's helpful to the healing process.
Yes, ma'am, it does help their healing process a lot.
So we didn't talk about t-shirts.
Oh, we didn't.
Real quick, let's talk about those because we have a little bit of time left. So talk about the t-shirts.
Okay, so our t-shirts for United in Pink are really cool this year. They have our new logo on it, and they are on sale at the sttamanyunited.org. They're also on sale at our gift shop at the hospital and at our cancer center if you'd like to come visit us. And they will be $25 this year, and all of the proceeds go back to this United in Pink campaign to help us get mammograms and education and screenings out there.
Okay, and all of the proceeds, let's just reinforce that, all the proceeds go to Educate, Screen, Prevent.
Yes, ma'am. They all go to educating, screening, and prevention this year for breast cancer and lung cancer because we want to make sure that everybody's got it in our community, and it goes to helping us do mammograms on the bus, all of the education on the Be Well bus throughout our community, and also within our healthcare system when we're doing it at health fairs and all of that.
Wonderful. Is there anything else you want to add before we wrap up?
Nope. I think I'm good. Thank you.
Well, thank you so much for being here, Kathleen. And thank you all for being with us for Healthy Living. Everything we talked about you can find at sttamanyunited.org. So thank you for joining us. We'll see you next time on Healthy Living.